this series this series of webinar. Welcome. I will share my screen now so that
And
we
until
can.
Andrew shares his screen, I just forgot to say that, as always, we will be recording this session, just so that you know.
Okay. Hopefully you can all see that now.
Yeah, we can.
Okay. So I thought I would present this case because it's rather unusual and an interesting diagnosis and something that seems very serious but able to be resolved with, as we will see, a very simple remedy. Often it's looked at in homeopathy that you need very complicated remedies for these types of conditions, but actually we just need the remedy that we need. I know it sounds simple, but I think one of the big problems in homeopathy often is that homeopaths will be looking at a case that may seem complicated, and then they start to theorize, if you like, to try to put forward some ideas about what they think the patient needs. So you start to think about various options rather than being able to see what's actually there. It's not really our role to be thinking about what the patient needs in a condition. Our role is to be able to perceive the data, if you like, the information from the patient, because our organism is giving, when we're unwell, it's giving out data, it's giving out information. Homeopathy is an informational system of medicine. It doesn't have any biochemical function at all. So it's informational, it's purely data. So as homeopaths, we're basically data analysts. It's another way to see us because we're analyzing the data that the patient is presenting or the symptoms that their organism is presenting in order to find something that is similar to their disease, to their problem. And then this encoded information, once given back to the patient, helps their organism to resolve the issue. So this, okay, I'll go through this because it's a little bit complex, but this 12-year-old boy is the patient, and the diagnosis was functional neurological disorder, which I hadn't heard of before. And when I looked it up, it basically doesn't mean anything. It means that they can't really find a pathological reason for the disorder. So it's called functional, and it's to do with the nervous system or brain, and there's something wrong. So it's basically saying we don't know, there's something wrong with them. But they give it a name, FND. So it says a problem with the functioning of the nervous system and how the brain and body send and receive signals. Physical and/or psychological risk factors can cause functional symptoms, which include a variety of physical, sensory, and cognitive symptoms that have yet to be explained by a recognized disease. So FND disorders are considered to be multifactorial, which means many different risk factors can contribute to the development of the disorder. The symptoms are real and can cause impairment in the quality of life that is similar to, and in some respects, worse than other neurological conditions. FND occupies a grey area between psychiatry and neurology that historically has failed to gain the interest of researchers and clinicians. The prevalence and potential reversibility of functional illness have piqued new research interests. New scientific findings are influencing how patients are diagnosed, treated, and creating an overall change in the attitude towards functional neurological disorder patients. So it doesn't really say much, say that we don't really know what this is. So I'll go through the story here. First appointment was in June last year. Now, the story was that in April of 23, so 2 years previously when he was 10, he went on a residential farm trip with the school, developed 2 so-called asthma attacks at night, and was feeling very homesick. There was no treatment, and he seemed to be okay on his return. There was some stress at home, as the father's sister had been diagnosed with an aggressive brain tumor. Was told off at an after-school club, which humiliated and upset him. And then in the mid-August, he caught a virus. They said he's got a virus. Question mark COVID. Anyway, some kind of virus which led to respiratory virus with cough and a temperature. He recovered, but then he had another so-called asthma attack before he was training for football, I think. Felt like he couldn't breathe, that he was going to die, like a panic, basically. So at this point, he was given a steroid tablet to take, even though the condition hadn't been diagnosed as asthma. And subsequent to that, once that acute phase was over, he was then prescribed Montelukast tablets. Now remember, this is a 10-year-old boy being prescribed Montelukast. Now, Montelukast is an immune modulating medication with potentially severe side effects, and these are common side effects, such as neuropsychiatric events. And this is a drug given to suppress the immune system or to moderate it in severe eczemas and asthmas, allergic conditions, even though it's able to create serious problems. At this point, I've said it wasn't even clear that the boy had asthma at all, yet he was given this very heavy medication. In the September, 2 days into the autumn term, he started crying and screaming in the evening and clutching his head, saying he was unwell and inconsolable. Went to hospital where he was given more steroids, this time prednisolone, with the reason they thought he still had asthma. Although he wasn't really suffering, he was more in a panic state and in pain. After the steroid that evening, his eyes became fully dilated and he was screaming and disorientated. When he looked at an object, he saw 4 of them and they were rotating in a circle. Went back to hospital where he lost control of his limbs and vision and developed involuntary eye movements, all blood tests normal. Hospital denied the steroids were responsible. Sent home, gradually returned to school over 2 weeks. In the October, started to feel unwell again, screaming, clutching his head, unable to walk. Back to hospital, where he was admitted for 10 days on a pediatric neurological ward where an MRI was done, where they found nothing and diagnosed him with this functional neurological disorder. After coming home one evening, he suddenly flipped into another world mentally. And everything, it's as if everything became new to him. Items became other things, and he had new names even for his family. Told these were not psychotic episodes by the neurologist. And he continued to flip between his new fantasy world and his normal self. When he was himself, he was weak and couldn't walk. When he was this other person, he was very physical and strong. Slowly spent more time in this other world. TV became a picture machine. It was like it was like showing someone a world that they had some familiarity with, but was new to them. Infantile behavior and notable character change. So from the October to the January 24, mostly in this other world. Of course, not going to school. Mid-January, returned gradually to himself up until May. The end of May, suddenly crying and anxiety before going to school after the holidays, flipped back into the other world. His memory was erased. He couldn't remember how to get dressed, take a shower, where he lived, or what car they owned. Didn't remember anything about school and didn't return to finish the year. Memory issues continued through the summer. Developed a temperature suddenly in the September. Not been back to school since this time. This is 24. December 24, memory issues and couldn't physically write anymore or add numbers together. He'd forgotten how to add up. Here, I started to write and add numbers up again with home tutoring. So then they brought him to see me in the June of last year. And now 12 years old, presenting with panic attacks, anxiety, worse from noise and crowds, nausea in the morning on waking. Fears, very strong fear of heights, giving him vertigo. He can't go to high places. Scary nightmares. He says to his parents, "Am I going mad?" Because of this situation he's in, where he switches between these personalities. Hot feeling in the stomach, strong sweating around his head and neck, profusely at night in bed, and swollen cervical neck glands, very tired all the time, likes to eat pizza, meat, cheese, and eggs, very fond of eggs, doesn't like sweets. Another interesting thing was when he's in his alternate reality, he loves sweets. When he's back to himself, he doesn't like them. So he has another personality that has different food desires. Fever history, he had this 39-degree fever with this last acute. So this gives us a good prognosis for him because as we know with the levels of health, if a child's getting high fevers and it's recent, then we have a good chance of recovery. It also means that the indicated remedy is usually clear because the organism has a lot of strength and ability to bring out clear symptoms. So this is even with this severe mental problem, we have a clear picture, I believe. So we'll see the analysis that I made. Very simple. Fear of high places, we can see carb argentum nitricum in 4th degree, and then sulfur. And then we see this symptom where he asked his parents, was he going mad? Was he losing his mind? So we have this fear of insanity that Calcara also has. When they start to get to the phase of Calcara, this is unusual because we don't usually see this. With Calcara, usually we see physical complaints, some fears and things, but reaching the mental level is more rare in my experience to be affected. So when we see it, they start to lose their ability to function cognitively and with their mental function, and they start to feel like they're going mad, they're going crazy. So we see this as a later stage of calc-carb. Vertigo, high places. As we know, the classic keynotes of sweating, perspiration, sweating in sleep on the neck and head is also a calcarian. There's love of eggs. So we have a very, very clear picture when we look at this. We see calcarea is clearly indicated. Here we can see all 5 symptoms beautifully lined up. Couldn't see a clearer case, really. We have a bit of metadata here. This is a little feature of Compass where there's some nice comparisons from some authors, mainly George, Professor Vithoulkas. So he compares cannabis and calcarea's fear of insanity. And then some other. This gives you a little bit of information about your case taking and some tips, which is useful. And the case is highly dependent on the following rubrics where we see why certain remedies come up. So we see that the initial consultation, calcarea was given in a 200C single dose. And it doesn't matter, you see, what the condition is, as long as you have a remedy so clearly indicated. The condition can be anything from eczema to cancer to mental diseases. This for me is a kind of psychosis state, although the neurologist denied it. It doesn't matter as long as the remedy is indicated. So, single dose calcarea, email on the 21st, so that's 2.5 weeks afterwards. So the boy has definitely changed since taking the remedy you prescribed. We feel that his mask of other-world identity has lifted, and we're seeing much more of his usual personality as we knew him before he became unwell. He has had more physical energy. I've even played football with a friend he hasn't seen for ages because he was very reclusive at this point, not seeing anybody, not going to school. You can imagine he's half in another world. So he's started playing with a friend, generally more sparky, meaning more active and cheeky, which was like his old self. He's also opened up about his feelings about things, but is now saying he's just anxious, for instance, about going to school, because he hasn't been for some time now. He hates crowded spaces and noise, both of which never bothered him at all before he became unwell. So follow up on the 1st of July. Parents and he report much more energy again, more awareness of himself, more open about his feelings, more sociable, more outward looking and desire to do things, more memory of the past returning. Able to verbalize his anxiety about attending new events, heat in the stomach when anxious, less sweats on the head at night, eating some breakfast now because he was not eating in the mornings, as not feeling nausea on waking so much. That was one of his symptoms. Glands are better, no longer swollen. Parents emphasize his anxiety now. So, second analysis, focusing on anxiety anticipating engagements, still the fear of the high places, fear of his position in society. So this rubric relates to what people are thinking about him. The vertigo, the anxiety in his stomach, we have a symptom. If he gets very anxious about something, he feels this, or worked up about something, he feels this anxiety in the stomach, apprehension in the stomach, nausea with anxiety, still the liking of the eggs and not liking the sweets. So actually what I did at this point is gave lycopodium 200 single dose. We know lycopodium follows calcarea often and nicely. So this was given 1st of July, follow-up 29th of July. Cognition and memory continuing to improve. Loves to have company now, eating breakfast. Has grown 3 centimeters in 6 weeks. Parents said they didn't see much change after the lycopodium. That meant that wasn't already happening. So looking at the analysis again, it's pretty much the same. And we know also that lycopodium generally loves sweets. So it was a little bit unusual to see a case that doesn't like them, although he did like them in his alter ego. But basically, I think that prescription didn't do anything. So went back to calcarea carb 1M, single dose. And the follow-up for this was on the 3rd of February this year. Still getting frequent nightmares which wake him up. Going back to school now, loves eggs. Still some sweat around the head at night, not so much. Still progressing. He's had no more of the episodes of going into this other world. This has all stopped. So the final analysis, we still see calc coming up top with argentum nitricum. Pretty much similar symptoms that he had before, general symptoms. So on the 3rd of February, I repeated the 1M and 10M as 4 hours apart, so an increased dose. And then had an email from a colleague of mine and friend of the family who'd actually referred them on the 12th to say, by the way, I spoke to about her son, and he is reported to be much better and not having any psychotic episodes anymore. He's still anxious, and I told her to come back again and explain that the anxiety would be normal. It would have to return first if he was to be cured, because that is what was suppressed in the very beginning. I'm so impressed with the carb prescription. Vasilis, now this is an interesting, she was a student of Vasilis Gegas, who was a brilliant student of George and teacher some decades ago, and taught a lot of homeopaths from I would say in the 1980s, 90s. She said, I'm so impressed with calc carb. Vasilis always taught us that strong remedies such as trimonium for such mental cases are needed. Remedies like calc carb would never help such cases. And there we go, it did, she says. So it was a revelation for her as well. So my analysis of this case, this boy was under stress at school and at home, and then he had a so-called asthma attack when he was away from home, which was probably more likely to be hyperventilation, like a panic attack. However, he was given steroids acutely, and then put onto montelukast, a known psychoneurological disruptor in a 10-year-old boy. This all suppresses his anxiety state. And then when he gets further steroids, as they continue to insist he had asthma in the form of prednisolone, he very quickly tipped into a psychotic state, therefore pushing the state deeper into the mental level. From an emotional level of anxiety, it goes into the mental level of psychosis. Also, there is some mental health history in the family and brain tumor in the father's sister. So there's some susceptibility there, it seems. Luckily, the boy remained, and this is very interesting, in an upper level of health with acutes and high fever. This is what saved him. This enabled his organism to produce a clear picture, and the indicated remedy worked very quickly, reversing the pathology, bringing him back to his previous anxiety state. There was no observed aggravation after the initial remedy, suggesting he's in level 1 or 2 of the levels of health. So that's where at the moment I'm waiting for them to return. I know there's some money issues, I believe, so they haven't come back to me since beginning of the year. But I know he's doing well and he's back at school, but there's still some anxiety which we need to look at, which was the original problem. So I think this also shows the danger of these drugs in children. As far as I know, no such drug has ever been tested on a child because it's not allowed to test drugs on children. So there are no trials to show that they're safe, and yet they're being given to children with known effects, mental effects, and yet they're still given, even on a diagnosis that wasn't clearly made. And then a lot of denial about what this problem was, and then it gets given a diagnosis name which doesn't mean anything, and no help at all. So luckily, he came to homeopathy. Okay, any questions on that case?
Right now, Andrew, we don't have any questions on chat, so maybe you could.
Oh, usually we have some questions.
Yeah, we do, and quite a few actually.
Yeah. Anybody want to clarify anything, or it was quite clear? Clear remedy, really, wasn't it? It's not a difficult,
Yeah, it was.
not a difficult case, but it's difficult. We have to understand the way that the pathology developed, and that even such a simple remedy can help such a deep condition.
Okay, so we have a couple of questions. The one is from Michelle McDonald, and she asks, why didn't you repeat Calcarea at 200 cc?
Yes, that's a good question.
Rather than go up in the potency.
Oh, I see. Well, Yes, you could do. I just chose to go up to 1M, but you could have repeated the 200. I think the lycopodium was a mistake. There was no need for it. It didn't do anything. Luckily, it didn't disrupt the case, and but I felt giving a slightly higher potency would push things on further. But 200, you could have given 200C again. It's true.
Okay. Apart from that, you have lots of congratulations, which was a beautiful case, fantastic presentation, very clear. Thank you. Well done, Andrew. Thank you very much. Here we have another. Okay, wait a minute. We have from Varangana. She asks, why not high potency 10M in the first time? Because
Yes.
of the very clear picture.
Yes. Yes. Again, you could give 10M. It's true. You could give any high potency in this situation, 200, 1M, 10M. Yeah, so you could do. I don't think you necessarily would see much difference. I mean, it's the correct remedy. The potency, would it have worked quicker? I don't think so. It was pretty quick change. So yes, it's why we give potencies is a little bit unclear still, isn't it? I mean, why a 200 and not a 1M?
Yeah.
We don't really know. I mean, we can give high potencies in these clear cases, especially when there's mental symptoms.
In general, Andrew, you've got lots of congratulations in the chat box. Everybody's very enthusiastic about this case. And basically, there's another comment from Helen Shakara, which says, fantastic, great results, wonderful to help anxious children. And then
Yes.
thank you from, many people. Emilia De Razi, Alina, Margarita Perez, they all thank you very much for such a wonderful presentation.
Well, thank you very much for joining and listening. I mean, I think we have to be aware of the dangers of these drugs.
Definitely.
Because they're certainly not tested or trialed on children. We don't know they're safe. In fact, we know they're not safe, and it's not wise to be giving such a strong drug for what might be considered and even an undiagnosed allergic condition to a young child, where you risk developing psychotic episodes. So for me, this is the craziness. Actually, it's the prescribing. Really, I believe the child needed was calcarea from the beginning.
Yeah.
Because when he went away from home, he had an anxiety attack. That was all it was. If you'd had calcarea then, none of this would have happened.
Yeah.
But
So I'm going to read you the last thank you note from an Anna, and then I think we could close the webinar since it was very clear and a very informative case. Anna says, thank you for the great case, informative to see what suppression can do and how homeopathy can reverse it.
Very true.
Yeah.
Yes, suppression. It's definitely a suppression. Yes.
Yeah. So in closing this webinar, I would like to thank you all for being a part of today's session. And I think that once again, we explored how Vithoulkas Compass software can be a powerful tool to help case taking in homeopathic cases. I'm sure, and we saw how you found this case and Andrew's insights as very transformative, just as I did. So a huge thank you to our speaker, Andrew Ward, for sharing his expertise and his deep passion for homeopathic case taking. Thank you so much, Andrew, for this. And we'll see each other again in a webinar next month or in a month and a half.
Thank you very much, everyone. Good weekend.
You too. Bye-bye.
Bye-bye.
Thank you.
Bye.
Bye.
Thank you.